Great, thanks and welcome to everyone to this session on economics, finance, and policy. We'll get started with the presentations in just a second, but first I want to run through just a quick technical reminders. The session is being recorded for folks who cannot attend live and will be available after the session ends. Everyone but the verbal presenters should be muted, and we've also disabled the chat function in Zoom. So please enter your questions and comments into the chat tab on Pathable, which we will be monitoring, and then presenters will be answering questions after this session out of the Pathable platform. And that should do it for technical reminders. So I would like to introduce our first presenter, Carolyn Delaire from the Aquaya Institute. Carolyn, why don't you share your slides and take it away?
Thank you, Darcy. Good morning, good afternoon, good evening. My name is Caroline from the Aquaya Institute. Today, I will present a piece of research that was funded by Water and Sanitation for the Urban Poor. The goal of this research was to understand how much safe sanitation for all will cost in urban settings. And we addressed this question by looking at 5 specific cities in sub-Saharan Africa and South Asia. So in many cities in low-income countries, sanitation conditions are inadequate. And this really undermines prospects for improving public health and economic development. So inadequate sanitation usually means 3 things. It means lack of access to private hygienic latrines. You'll see here on my slide a toilet that we photographed in Kisumu, Kenya. It usually means hazardous pit emptying practices with service providers operating without protective equipment and dumping the waste in the open environment. And usually it means absence of treatment. In fact, it is estimated that less than half of the waste in low-income country cities is treated before disposal. So to make progress towards SDG 6.2, municipalities will need to identify the most appropriate sanitation approaches and the most appropriate financing strategies. And today I'd like to argue that they cannot do that without having comprehensive cost information at the city level in their unit of analysis. And what I mean by comprehensive is information that includes capital expenditure, operational expenditure, and capital maintenance. So municipalities may consider a range of sanitation approaches. They may consider on-site sanitation combined with safe emptying services, such as those provided by formal manual emptiers, here on the bottom of my graphic, or vacuum truck operators. They may consider container-based sanitation, a service where households lease a container-based toilet that gets empty at least once a week by a service provider. They may consider sewerage, and they may consider hybrid approaches, which here I've called mini sewer. From the perspective of the household, it is very much like a sewer. The waste is piped away. But unlike conventional sewers, where the waste is piped all the way to a treatment plant, here in this hybrid approach, it is piped to a neighborhood communal septic tank. So the objective of our study was to estimate the financial requirements to achieve universal sanitation by 2030. And this meant meeting 2 conditions. Number 1, achieving 100% access to an improved toilet that is located on premises and shared by maximum 3 households, and achieving 100% of safe transport and treatment for the waste. So we conceptualized the financial requirements as being made of 2 components. Number 1, the new municipal infrastructure that will be needed to transport and treat the waste that is currently untreated. So that's the first component. The second component is a household subsidy that will be needed in low-income areas, or LIAs, to ensure that households can access toilets and emptying services. And we defined the required household subsidy as being the difference between household cost, So what a household in a LIA would normally have to pay to build a toilet or purchase emptying services, minus what this household is typically willing or able to pay. We approach these questions in 5 different cities: Kisumu, Nakuru, and Malindi in Kenya, Kumasi in Ghana, and Rangpur in Bangladesh. To measure willingness to pay, we surveyed over 2,000 households in urban and peri-urban low-income areas. We specifically targeted homeowners and landlords who did not have adequate sanitation for themselves or their tenants. I should say that when it came to questions on container-based sanitation, we also targeted tenants. And we measured stated willingness to pay using the double-bound dichotomous choice method. And I'll add that in a couple of instances, we also measured revealed willingness to pay or ability to pay through a real sales random price voucher trial. In parallel to this willingness to pay exercise, we collected detailed costing information from a number of key informants: households, utilities, masons, engineers, public utilities, NGOs, local authorities. And our goal was really from the bottom up to understand what it cost to build a toilet, what it cost to access safe emptying services, and what it costs to build, maintain, and operate municipal infrastructure. All right, so I'm now going to walk you through the main findings of this study. So here you're looking at a chart presenting the cost of building a toilet, and this includes the superstructure, across different cities. So this is the cost for building a poor flush toilet connected to a line pit, a sewer, or different other forms of containment. So this captured the cost of labor, materials, transport, and like I said, from the pit to the superstructure. So you'll notice that the costs are quite high. And it was on average $1,000, which was higher than we expected. Now compare that with willingness to pay in low-income areas. I'm showing here the average willingness to pay as well as the 20th percentile of willingness to pay. And that's relevant because this is the amount that the majority, like 80% of low-income households were willing to pay. And we defined the required household subsidy in LIAs or low-income areas to be the difference between full cost of what a household would have to pay and their 20th percentile of willingness to pay. So a very similar picture for emptying services. Here I'm presenting the cost and willingness to pay for one emptying job, either by formal manual emptiers or VTOs. And again, this information helped us estimate the required household subsidy to improve coverage and access. And a similar type of results for the household fee for a container-based sanitation. So how did we use this information? When you aggregate this at the city level and you consider all the households that will need subsidies in the next 10 years to access toilets and emptying services in Kisumu, we were able to estimate the total subsidy amount over the next 10 years. So this is what I am presenting here on this chart in black for different scenarios. So a scenario where all households received line pits or are subsidized to access the sewer or are subsidized to access CBS. And again, this captures all the types of subsidies they will need for emptying and also the hardware. On top of that, we estimated the cost of building and operating the new municipal infrastructure that will be needed to process the waste that is currently untreated. And so together, these two components give you the 10-year financial requirements for achieving universal sanitation. And I want to emphasize that this is net of household contribution. So you can view this as the full subsidy or the full amount of what needs to be financed. I'll give you a glimpse at a similar chart for Malindi in Kenya and Kumasi in Ghana. So what I'd like you to notice is that the overall financial requirements fluctuate quite a bit between technology options, and you'll notice they're highest for sewerage. You won't be surprised. And another thing I want to point out is that this breakdown between the direct household subsidy and the municipal infrastructure varies sometimes between options. So if you look at right in the middle of the chart, scenarios 3 and 4 for Malindi. One is septic, the other one is mini sewer. Their total financial requirements are on par. But for the scenario involving mini sewers, the requirements for direct household subsidies are lower. And some municipalities may prefer that scenario because it minimizes the volume of household subsidies they'll have to handle. And anyone who's done that knows that this is particularly difficult. All right, so moving on to my conclusions, I'd like to highlight 3 main takeaways. Number 1, safe sanitation is not affordable in low-income households of developing country cities. This means that achieving universal and equitable sanitation will require household subsidies, and I mean for households to access toilets and emptying services. Now, I think the issue of how to deploy household subsidies effectively and at scale really deserves additional research because this is not straightforward. Number 2, as you've seen in other studies, sewerage was the most expensive approach in our estimates, and not particularly because of the household subsidy part. It was because of the municipal infrastructure part that is more costly than other options. Therefore, municipalities should really consider alternatives like on-site sanitation, at least in some parts of their cities. And number 3, I'd like to highlight what I think is a benefit of breaking down the financial requirements into those 2 components, household subsidies and the cost of municipal infrastructure. I think this distinction is relevant because you may not finance the 2 components in the same way. Your municipal infrastructure, your treatment plant, you may require a loan or a traditional grant for this. But for the direct household subsidy part, the finance that will be channeled directly at households, you may look at result-based finances or other approaches. So I'm hoping that presenting results this way, which is not conventional, opens the door to discussions on effective financing options. Thank you very much. I'll stop here and be happy to take any questions.
Thank you so much, Carolyn, for that presentation. If I could direct participants to the chat box on Pathable to enter their questions, I will relay some of those to Carolyn. We have about 4 minutes for questions here. So we've got one here that says, do you have follow-up research planned? And if money were not a constraint, what do you think your next research steps would be?
That's a very good question. I think my next research question would be to examine how to deploy household subsidies effectively and at scale. Aquaya has done other research in parallel to this to actually pilot household subsidies to promote safe emptying services. And in some ways, this research has opened more questions than it answered. So we would really like to do additional research to understand how do you do that? How does a city like Kisumu is going to start distributing subsidies to something like 40,000 households? So I think that's a very important future research area.
Great. We've got, let's see. There's one here that says, how do you think that households with zero willingness to pay may not utilize subsidies even if offered?
Yeah, that's a good point. There is a place for regulation and enforcement, of course. We tested that concept a little bit by distributing random price vouchers that people could actually redeem to purchase services. And we found redemption rates at different price points comparable to what our survey results stated. And in this case, so that anyway, just to emphasize that we felt there was validity to our stated willingness to pay results. In general, yeah, there will always be households who are not able or willing to pay anything. I think we're a long way of worrying about that. There is a long way to go, and a lot of households who are willing to pay something that need to be served before enforcement comes in for the last mile.
Great, thanks. And we have time for one more question. So this last one here in the box is, what do you think is the main reason why the lined pit scenario 1 had the lowest NPV of household contributions for both municipal / household level requirements in Kisumu and Malindi? What other variables might you consider during implementation that would affect, or sorry, other than cost, what other variables might you consider during implementation?
I mean, I'll say one important piece whose cost we have not captured here, but would be really important for implementing on-site sanitation is monitoring and enforcement. Of course, the beauty of sewerage is that there is no responsibility on the household, right? They just flush it away. For on-site sanitation, there is a big responsibility on the households. They have to order their emptying regularly and ensure it's done. And cities in Asia or Europe who are doing this well and safely actually have a huge layer of enforcement and monitoring on top of it. So I think that aspect is really important for implementation.
Great, thank you so much. We are out of time, so we're going to have to move on to our next presentation, but I do encourage our attendees to continue participating in the chat box and continue to engage with each other as we move into the next presentation. So next up we have Daniel Smith from Stanford. Daniel, if you want to start sharing your screen and take it away.
Great, thank you, Darcy. So my name is Dan Smith. I'm a PhD candidate at Stanford University, and it's really an honor to present this work on behalf of a large team from Stanford and ICDDRB who've been working on it for the last 5 years. And so this study was about finding a way to deliver safe water in low-income urban areas in a way that was financially sustainable. So efforts to address this problem have focused on equipping households with point-of-use water treatment or on big infrastructure, both of which have some limitations in this context. Point of use requires individuals to change their behavior and hasn't scaled up so well in many locations. And large infrastructure, of course, costs a lot and takes a lot of time, and its benefits might be mitigated by intermittent water supply. In the middle, we have water treatment delivered at the point where people collect their water. In this study, we used what we call inline tablet chlorination, where water flows over tablets of solid chlorine as it enters a water storage tank, so that when people collect the water, it's already disinfected. And this has several advantages. You don't need to change your behavior to get your water. It treats all water, not only a small amount for drinking. It only takes one person to administer per water point. There's no large upfront cost, and it's been demonstrated to reduce child diarrhea by 23% in Dhaka. So most people in Dhaka live in rental housing. So our team hypothesized that landlords could perceive a competitive advantage in the rental housing market by providing their tenants safe water. And landlords could capitalize on that advantage by charging through the rent, and in that way, have a market incentive to pay for safe water in the long run. So we use this model to deliver an inline chlorination service as part of this study. We had landlords as the principal participants and customers of a service provided by ICDDRB to install and maintain tablet chlorinators. And in that way, landlords could provide safe water alongside, or that is bundled with the rental housing to their tenants. And the tenants would pay their landlords, and landlords had a way to pay for the service through rents. So using this model, we tried to answer these 2 research questions in a price experiment. The first is, what is the effective demand of willingness and ability to pay? What is the effective demand, that is the willingness and the ability to pay in cash of landlords for an inline chlorination service? And second, what characteristics of landlords and their tenant households are associated with that effective demand? So we conducted the study in 2 consecutive cohorts. The first was in what I'll call a low-income area in an informal settlement, where we collected data for over a year, starting in 2015, with 97 landlords and 368 of their tenant households. And everybody in this cohort got water from hand pumps connected to the municipal piped water supply. In the second cohort, which I'll call middle income, we enrolled 99 landlords and 278 of their tenant households. And we collected data again for over a year, starting in 2016. And everybody in this cohort got their water from private or shared taps to differentiate them from the low-income cohort. And this is what the inline chlorination looked like in that middle-income cohort. You can see the little blue thing is the tablet chlorinator. On the left, it's in a rooftop water storage tank that serves an apartment building. And on the right, you see in the close-up how part of the water flow goes over the tablet chlorine and then mixes back with the rest of the water in this tank so that all the water going into the building is been disinfected. And technicians in our study made 1 to 2 visits per week throughout the time landlords were subscribing to the service and recorded over 4,700 tests of residual chlorine. So again, in each of our cohorts, we went through this sequence. We started by marketing a subscription to this inline chlorination service to landlords. And then if a landlord was interested, we conducted an auction by asking a landlord to bid one of 6 predetermined prices or 0 price. And if they bid greater than or equal to a randomly selected price, the landlord won the auction. And so winning that auction meant that the landlord had the opportunity to pay that randomly assigned price each month for the service. And this is a version of what's called a Becker de Groot-Marchak auction. And the next step was actually collecting a first payment in cash from landlords. And if they did pay, we installed the tablet chlorinator. And then for up to 1 year, technicians collected those monthly payments and operated and maintained the tablet chlorinator. And if landlords stopped paying or didn't want it anymore, we removed the chlorinator from their building and they exited the study. So this sequence gave us 3 ways to measure demand. The first was as the bid price in dollars per month in that auction, which is a measure of stated willingness to pay, meaning there was no exchange of money. The second way was as what I'll call initial effective demand, which is we measured as a binary of actually making a first cash payment at the price the landlord was assigned. And third, and most important for financial sustainability, is what I'll call continuing effective demand, which we measured as the percentage of payments that landlords actually made that they could have for up to that 1 year. And so I'll get back to some results from the stated willingness to pay in a moment, but I want to jump straight to a really interesting result comparing initial to continuing effective demand. So for results related to research question 1, I'll show first a demand curve showing initial effective demand between low and the middle income cohort. And the takeaway from this is that we didn't find any statistically significant difference in initial effective demand between these cohorts. So to read this graph, on the y-axis we have the randomly assigned price that landlords were paying. On the x-axis we have the percent of landlords who made at least 1 payment as a binary, which is the average percent that the landlords who were assigned this price actually had to pay. So to read this, at a price of about $1.50 per month, you can see that about 80% of landlords in both cohorts made their first payment. But if we compare that to our measure of continuing effective demand, there's a marked difference between the cohorts. So here, we can see that at that same price point of about $1.50, a little less than low-income landlords made a little less than 40% of all of their payments compared to the middle-income landlords who made about 80% of all their payments. And this was a statistically significant difference. So the takeaway here is that over time, we saw a difference that we didn't see originally when actually measuring demand with real cash payments. But overall, the demand here was somewhat higher than what had previously been measured for both point of use and manual chlorine dispensers in Dhaka. So moving on to summarizing results for research question 2 about the characteristics associated with effective demand. We ran 3 regressions using the same predictors, but with outcome and each outcome was one of our 3 indicators of demand: the stated willingness to pay, the initial, and then continuing effective demand. And so to summarize, I want to point out 3 things. The first is that there were more characteristics associated with what landlords said they would pay than with either initial or continuing effective demand. For example, landlords with higher incomes and who lived in the property where they also rented to tenants said they would pay more in the auction. But secondly, when we actually include a real price that they had to pay, almost all of those characteristics evaporate and price becomes a very important predictor. So that shows that landlords were highly price sensitive, especially in the low income cohort. And third, there were even some important differences between predictors of continuing versus initial effective demand. For example, landlords who charged tenants separately for water, that is separate from rent, were more able to pay over the long term, even though that had no bearing on their first payment or what they thought they would pay. And also I want to summarize briefly the service delivery results. We had very consistent delivery of chlorine that was both detectable enough to disinfect, but also acceptable enough in Dhaka, acceptable to taste, that is. 76% of tenant households were satisfied with the service as well, so that was good news. But interestingly, we didn't find any evidence that landlords passed on the cost of the service to their tenants. One indicator was that only 1% of tenant households told us at a time of follow-up that their rent had actually increased after their landlord started paying for the service. So to sum up, I want to leave you with 3 main takeaways. The first is that the level of effective demand and the efficacy of chlorine delivery compared very favorably with point of use and manual dispensers that have also been tested experimentally in Dhaka. And the second is that our results provide a benchmark for the price that inline chlorination using this tablet chlorinator would have to attain to be financially sustainable. And there was better potential for that among middle income rather than low income consumers. But given the efficacy results, subsidy could really be warranted among low income households. And finally, it was really important to measure demand over time. That's because the level of effective demand changed and what motivated effective demand changed. It's kind of like when you sign up for a gym. When you sign up the first time, getting yourself in there for the first month and getting yourself there and paying for months on end might have very different motivators. So thanks very much for listening. You can contact me anytime. Thanks to our sponsors and partners, and I'd love to take your questions.
Great, thank you so much, Daniel. I will just moderate questions out of the chat box. So again, please place your questions there. We have a few that are all around the theme of ongoing operation and maintenance costs and people thinking about how did you deal with issues of breakage or clogging of the chlorine dosing over time? And what did the costs of that look like? And how might that affect scaling this type of project?
Yeah, thanks for those questions. Firstly, in terms of actually providing the technical parts of the service, we had a team of technicians who were supervised by an engineer at ICDDRB. So there was a whole technical team only tasked with making sure things were running right, doing things like making sure there were enough tablets in those chlorinators, and responding if landlords had any questions or technical problems. And that did contribute to the costs. We've estimated kind of a high end and a middle and a low end cost for this. And the kind of highest we can think of, which is what it cost approximately to provide the service through this research project, was about $6 per property or rental property per month. And the lowest or the middle, which we'd project is like an initial cost to provide this as an enterprise, is about $4 per month. So it does leave, in terms of scaling, there is a better financial potential among our middle income cohort and similar populations in Dhaka. And then one way we think that we could drive down those costs is by testing this at a much larger scale, and really making even more efficient use of the human resources that are needed for those technical improvements that I mentioned earlier.
Great. We have another one in here asking about how, if at all, you think this research might apply to rural areas.
Right. Well, I'm glad you asked. I have another study that I'm working on coming up about those using similar techniques in a rural area, but for water supply reliability. So I'll get back to you in a few months about that. And I know there's work going on with Aquaya, where Caroline works. They're starting to look at the efficacy of chlorinators on hand pumps, and I believe there's another presentation on that in this conference as well. So the short answer is there's research coming out about that, and it'd be great to see the results.
Let's see. If landlords weren't passing on costs to tenants, then why do you think landlords who charged separately for water were more likely to continue their payments?
I think that's a great question. It's something I'm mulling over as well. We have some indication from some follow-up surveys and interviews we did that landlords really liked that the chlorinators got all of the water and not just the water for drinking. I guess the underlying this question is that there might be a relationship between the charging separately that's not completely linked to being able to charge through the rent. And I guess this is something we can look into more deeply, but we didn't have really deep, I'd say, qualitative follow-up to dig into the more kind of open-ended motivations that landlords might have for doing that.
Great. We have time for one more. I'm scrolling for ones that we haven't answered. If someone wants to jump in and enter a new one, I'm happy to take that. Otherwise, I'll keep scrolling here. Okay, I don't see any in the box, but I guess I'll close out one for you then myself. What do you see as the next step to this research? What are you hoping to investigate next?
Yeah, I think the next step is really testing at a larger scale to see if there are indeed economies of scale or diseconomies of scale in providing the service. And I think we have to take an important look at the difference between trying to improve water quality in low-income informal settlements where we had substantially lower effective demand over time than in a more middle-income neighborhood. So that we should also think about effective ways to subsidize that or compare the costs of providing safe water in different ways.
Great, thanks.
Thank you.
That's all the time we have left in this slot, but thank you, Dan. If you could close out and we will move on to our last presenter. The last one we have here is Ben Tidwell from World Vision.
Hi, thanks. I'm assuming you can all hear me, but start waving if you can't. So my name is Ben Tidwell. I'm currently the WASH research lead at World Vision, but I'm going to be presenting some work from my postdoc at the Kennedy School. You'll note that this, as with the other projects, was a part of a big team. Several of the names identified there, working with ICDDRB in Dhaka, and as well, the study was funded by WASUP. Yeah, I need to mention the study was funded through WASUP's Urban Sanitation Research Initiative, funded by UK aid from the British people. Yeah, we're really grateful for that support. And obviously these institutions, as you see with the other two prior presentations, are really involved in this question. So really grateful for that. So I'm going to talk today about user preferences for sewer connections in Dhaka slums. So for those of you not familiar with Dhaka, we're talking about very high density peri-urban informal settlements, low income communities as they call them. And so, very rudimentary kinds of open sewers and sanitation options are available there. In this context, there are a number of public toilets in these low-income communities, often constructed by and sometimes managed by NGOs. There are also shared household toilets of varying quality, as you see here. These are usually shared by 3 or 4 households on a sort of plot of land managed by a landlord. And as I mentioned there, the primary sort of containment if you can call it that, is these sort of open drains like you see here. So they often get clogged or very much in everyone's way, and usually discharge to nearby bodies of water with some serious potential health consequences. So given that setting, we wanted to look a little bit about how to improve potential sewer connections in these low-income communities. So the existing network covers about 20% of the population and treats about 2% of the waste generated there. So there's a number of issues beyond just connections in terms of pumping and blockages. About 35% of the population in Dhaka lives in these low-income communities. And so to address that, the Dhaka Sanitation Improvement Project seeks to expand waste collection to about 4.7 million people over the next 15 years or so. And so what we wanted to do as a part of this research was to assess feasibility, and by that we meant the cost and willingness to pay of connecting residents to, of low-income communities to sewers through various sort of technologies. So we were looking on the costing side, much more, at everything from sort of traditional sewers to condominial sewers to different sort of decentralized treatment approaches. But in this presentation today, I'm going to talk mostly about the willingness to pay aspects. So this study differs a little bit from some of the prior work in that while the products in some sense existed for some of these, so you could see if someone would pay for a chlorinator or see if someone would pay for emptying or anything like that. We were trying to assess before the utility was looking to put in these sewer lines, what is the potential willingness to pay to help them plan? And so there's obviously some methodological challenges with that. So I'll present here findings from several different approaches. So our methods, we looked at, we did a quantitative survey for this work of 500 landlords and 500 tenants in 5 different low-income communities. We used 4 different methods that I'll try to describe at a really high level, just so that you understand more the sort of how it works rather than any sort of deep, statistical biases or analytical techniques or anything like that. So we started off just with simple attribute importance ranking. So we literally asked people what was important to them about sanitation, about sewerage, things like that. This is useful just almost as a qualitative type tool, some sort of ranking, but there's no trade-offs built in. So someone might mention something that's very cheap or very costly is very important, and those have very different implications for whether or not you can deliver them. So building on that, we use some more traditional willingness to pay methods. So we use contingent valuation, which in this case was simply a, would you be willing to pay for a sewer connection, both initial and ongoing service fees. And this is, it's simple and easy to understand and interpret, but some recent work by some of those involved in this study have shown that it has both hypothetical bias. So sometimes people will say they're willing to pay more than they are, but worse, actually, it's inconsistent. So for different sorts of products, people may be more willing to say they're paying for, say, a socially desirable thing like a toilet than something where there's not a sort of societal benefit. So we, building on these two, we also added a series of discrete choice experiments, which are essentially, here's a sewer product, here's a sewer product. They have different costs, they have different attributes. Which one would you prefer, or neither? So we can use this to estimate trade-offs between different attributes. But again, it's only stated preferences, though we have some evidence that these are less inflated than contingent valuation approaches. And then finally, hedonic pricing. So this is a revealed preference method. So it's using actual market data, but it's also comes with a lot of challenges in that you can't vary things as you would like. So if most people that have a certain kind of toilet also have a certain kind of containment option, that multicollinearity can result in estimation challenges. So there's strong assumptions required there as well in terms of pre-specifying a model that can limit the effectiveness there. So I'm just going to present some of the high-level findings of these 4 approaches. So in terms of important attributes, we have here the total percent of people that reported the attribute is important, followed by landlord and tenant separately, and female and male separately. And there are asterisks where there's a statistically significant difference between, say, landlord and tenants in the example of water facilities, the first one listed on the left. But the two takeaways that I have from this are, one, that there aren't significant differences really between landlords and tenants and females and males, you know, on a sort of, you know, qualitative difference. But two is to say that you can see some natural groupings here of availability of water as really important, as well as the monthly bill amount. There's sort of a second grouping of whether there's a sewer connection, the quality of the infrastructure, and how frequently the toilet clogs. And then there's a number of other things that were less frequently mentioned, you know, dealing with shared sanitation, such as the number of cubicles, type of flushing system, distance from the household. Using contingent valuation, we looked separately at landlords and tenants for their willingness to pay for a monthly fee for a sewer connection. So an earlier hypothesis we had is that some of the challenges in sanitation markets were because of a difference in perception of willingness to pay and actual willingness to pay, perception of landlords and actual by tenants. And so we broke this out separately. We saw actually no statistically significant difference and almost no difference at all between the levels of willingness to pay between landlords and tenants. But generally you see that you know, more than 85% say that they are willing to pay or perceive tenants as willing to pay. And median values are something like 300 Bangladeshi taka, which in this case is about 10% of monthly rent, which is probably more relevant than the actual dollar value for assessing relative preferences. So we looked at choice experiments to try to figure out, you know, how much people were actually willing to pay for this in terms of rent, to try to figure out how we could sort of catalyze landlords to make these improvements in settings so that tenants would have an opportunity to purchase these kind of accommodations, to rent them. And so we did a series of experiments where we would vary the toilet quality, the toilet location, the type of containment, and whether or not there was hand washing present. And so this was, you know, we would do a low quality toilet that was on plot with a connected to an open drain and no place for hand washing, versus maybe, again, a low quality toilet with an on-plot that was on plot with a sewer and well maintained. So all the attributes didn't necessarily have to differ, but they were controlled in a way so that we could estimate precisely the differences between these individual attributes. And so here I just want to report the relative preferences for these in terms of willingness to pay. And so we standardized the high quality toilet, which was essentially a cement superstructure and a tin roof and a cement slab with a pour flush toilet as the sort of 1.0 on the relative willingness to pay. We saw that the connection and the containment was significantly higher priority with higher willingness to pay. That a place for hand washing was slightly lower priority, slightly less willingness to pay, and whether or not it was on plot or farther away was really unimportant. Though, of course, in all contexts, the setting matters. On plot toilets here, you know, or off plot toilets were maybe only a 5-minute walk away. We're not talking about a significant distance they had to walk. And so I don't want to at all present all of this data. It's there if you want to see it, but just wanted to say from the hedonic pricing, the sort of relative importance of different aspects of sanitation. As I mentioned, we didn't have sewers, and so we couldn't say what is the actual willingness to pay for sewers here. That rarely varied within a geographic area. It was more high income areas had sewers and low income areas had open drains. And so we can't really estimate the contribution in those kinds of things that differs by treatment or by containment type. But we saw, you know, as you would expect, the number of rooms and some other characteristics were really important about the payment for rent. But notably, the presence of a septic tank played a large role here. So about a quarter of rent was attributable to the presence of a septic tank.
Then you're at 10 minutes.
Sure, thanks. So there's a number of other interesting things here, but I think the takeaways are, there's a lot of multicollinearity on aspects of toilet infrastructure, so ability to precisely estimate some of these values is really limited. And some of these things that we measured them as a nice concept, like the presence of an outside lock on a toilet, were not exactly that simple, because sometimes an outside lock symbolized a toilet that was owned by a different group, maybe of a different quality, something like that. And so these weren't sort of freely varying. So I just want to give a few takeaways here. The actual data, I suppose, are interesting in themselves, of the separate sort of bits of data. But I think that the overall picture and some takeaways methodologically are probably the bigger things that are important to share now. One is that it's clear there's significant prioritization of sewer connections among landlords, among tenants. As it states here, each method has limitations, like we covered. And in particular, more advanced joint estimation techniques would be helpful. So there's methods that are being developed now that can take sort of the overall estimate of willingness to pay from hedonic pricing, and then they can tune the weights of the individual features based on results from discrete choice experiments. But honestly, most people that use these are either dealing with purely hypothetical products like new drugs that they're wanting to develop, or looking at housing markets. And so this sort of merging of techniques isn't really necessary in a lot of the places that would use these techniques separately, other than WASH, I think, and some similar development priorities. But the most important thing, I think, that should come away from this, rather than just hearing about estimates of willingness to pay and things like that, is that I very strongly believe willingness to pay shouldn't be equated with what fees should be assessed, especially of low-income residents. Fee structures and types of sanitation are often anti-poor. So in this area, people were worried about having on-site sanitation, because they thought then the government might not pay for the emptying. And so even if sewers were more expensive, they were worried that the actual policies might be anti-poor. And as we've seen presented earlier today, and in work by the World Bank, the Doing More with Less report, most of the subsidies are going to the wealthy, and the wealthy are heavily subsidized, both in lower income countries and in the US. And so I just want to make sure that as we're thinking about all these precise methodologies, that's a very small part of a large policy question about what we should do in terms of intervening in these settings. Thank you.
Great, thanks for that, Ben. We are just running up on time here, but we have probably time for 1 or 2 questions if people want to add those to the chat box. The chat box is quite active, which is great, but it makes it a little bit hard to track questions. So if you entered a question in earlier, please do enter that again to be sure that we see it. So we have one here that says, what is it about sewers that households find desirable? Do you think there will be less clogging, less odor, other factors, etc.?
Sure. Yeah, actually, so we sort of thought that in other settings, we've done some similar work and thought that maybe the landlords would care in particular, because it would be easier to have sewers than to have to arrange emptying, things like that. But landlords and tenants strongly preferred sewer connections in these areas. And from the qualitative work, there were a couple of reasons. Yeah, one is that, here we're talking about open drains flowing through the midst of walkways. And so it's not like people can avoid these sorts of things. There's animals running around in that, there's kids running around in that. And so I feel like the perceived health impacts were quite high among the population. And secondarily, as most of you probably know, there's lots and lots of flooding in Bangladesh. And so there's a thought that, these sewers might be better able to mitigate both, contamination in the environment and flooding of the individual toilets in times of flooding. So I think those were the clearest that came out.
Great, thanks. We are just slightly running over time here, but my understanding is the chat box will remain active. So people are free to engage in that even after we close out the session here. But I would like to thank all of our presenters for such great presentations today, and release you all to enjoy the rest of the conference. Thanks, everyone.